details in pediatric surgery were only discovered in the 20th century. However, pediatric surgery started long before this. The first operation that was done was circumcision, and it was done 600 years before Jesus Christ. It was considered as a pact between God and Abraham. The first surgical techniques in pediatric surgery were described many hundred years later. For example, Hippocrates described surgical treatment for long bone fractures in Greece. And then many years later, there's another Roman physician who described surgical techniques for cleft and tonsillectomy. However, the most important and the most famous book that described pediatric surgery and many other surgical techniques was Kitab al-Tasrif. This famous book was translated in many other languages. And it was written by the great Al-Zahrawi, which is considered as the father of surgery. He was very famous because he discovered and designed his own surgical instrument, and he was the first surgeon and the first doctor to use sutures in his operations. He described many techniques that are used in pediatric surgery, for example, hypospadias and clefts. However, the first real textbook that was completely dedicated to children's conditions was written and was published by a Swiss surgeon in 1563, and it was also translated into many other languages, and it was considered as a manual of pediatric surgery. And many years later, there was another Turkish textbook that was also only dedicated for children's conditions. In the 19th century, the real medical separation between children and adults was made clear, and many great children's hospitals were established at that time. So in 1802, for example, there's Hôpital Necker Enfants Malades in Paris that was built, and then in 1852, the Great Ormond Street Hospital in London was built, and then in 1869, it was Boston's Children's Hospital. I spent 4 years at Hôpital Necker Enfants Malades, and what's really funny is that the entrance of the hospital is exactly the same as it is in this picture. Even the gate is exactly the same. And what's even funnier is that I live just across the street. So I know that my apartment on this photo is just across the street, just only 200 years later. Necker was always associated with the name of a great pediatric surgeon. And what's really important is that this great pediatric surgeon was in fact a woman pediatric surgeon, and her name is Madame Claire Fekete. She's actually still alive, and she's the mother of pediatric surgery. What was special about this woman is that she was not only clever, she was not only talented, she was not only skilled. Everyone wanted to be her. In fact, she was beautiful. She had a perfect body. She was blonde. She had blue eyes. And she was really everything a surgeon female ought to be. And every man wanted to be with her, and every woman wanted to be her, in fact. The 20th century is the century of pediatric surgery. So what we call the founding fathers are those pediatric surgeons who had a very important role in the advances in pediatric surgery. For example, Mr. Hirschsprung is the one who described Hirschsprung's disease. He understood why some children had a very severe constipation and had abdominal distension, and he gave his name to his disease. Mr. Ramstedt, for example, is the one who described pyloric stenosis, and he described the technique to treat this pathology, which is the pylohotomy. And this technique is still the only technique used actually for this pathology. Mr. Ladd described the intestinal malrotation in children, and he gave his name to the operation that we still do actually when a child has a volvulus, when he has a malrotation in his gut. Mr. Kazai understood and explained and gave his name to the technique used for biliary atresia, and Mr. Gross Mr. Gross described the technique for the ligation of the PDA. What about women in surgery and women in pediatric surgery? Women have always been discriminated. They have always struggled to find a place in surgery and in pediatric surgery. However, there are many arguments, there are many paintings, there are many ancient texts that show that, in fact, women started practicing surgery ages ago in Egypt, in Greece, and in Italy. For example, here there's a drawing, there's a picture of a queen of ancient Iraq. They say that she was buried with her flint and her bronze surgical instruments. So as I said, women really struggled to find their place in surgery. They were always forbidden from practicing. For example, King Henry VIII in 1540 excluded women from practicing surgery. He said, no carpenter, smith, weaver, or woman shall practice surgery. Look at this picture, it's very expressive. It's filled with men. There's not a single woman in this picture. Who are the mothers of surgery? The first woman surgeon and the first woman who in fact practiced pediatric surgery was Catherine Bowles. She was the wife of a surgeon. She practiced in the 17th century. She operated hernias, hydrocele, and bladder stones, which are in fact pediatric surgeries. However, the most known female pediatric surgeon is Dr. James Barry. Dr. James Barry was a renowned Irish surgeon. He was an army surgeon. He was famous because he had very successful interventions, but he was famous mostly because he did not have any beard. And when this Dr. Barry died, they realized that in fact Dr. Barry was a woman surgeon and his name was Miranda Stewart. I did not find any picture of Catherine Bowles. Whenever I typed Bowles, I had images of Camilla Bowles, which is not at all our topic today. But I did find a portrait of Dr. James Barry. I don't know if some of you know the series called Outlander. In fact, this is the story of a woman called Claire Fraser. And this woman, in fact, lives in the 20th century. She's, in fact, a nurse. And then she goes as an adult to med school and becomes a woman surgeon, which was something that was very rare at this time. She has the power in the series to travel through time, so she could go 200 years before her time, and she practiced what she learned, in fact, in the 20th century and the 18th century, and she managed to save many lives like that in Scotland. In fact, what I love about the role that she plays is that she is what every female surgeon should be and must be. In this series, she's a beautiful woman, but she's skilled, she's talented, she's brave, and she's human, and she has a lot of ethics. So now you are locked down. So if you have free time, you know what to do. Watch this series. It's really nice. The emergence of women in pediatric surgery is mostly in Australia. There's a complete gender equality in Australia. More than half of all pediatric surgical trainees actually are women. So practically, what should you do to become a pediatric surgeon? In fact, you will need 7 years of medicine in St. Joseph University, of course, and then you will need 6 years of surgery. The first year is a year of general surgery, so you will go through many surgical specialties. Then you will have 3 years of plain pediatric surgery, including pediatrics, including pediatric intensive care and pediatric neonatology. You will need 1 year of adult digestive surgery and at least 1 year abroad. So whenever you've done all this, you have your diploma and you can start practicing. Okay, in Hôtel Dieu and in St. Joseph University, there's a place for a pediatric surgery resident every 2 to 3 years. Okay, not every year, every 2 to 3 years, there's a place for a pediatric surgery resident. What does pediatric surgery include? Pediatric surgery, in fact, has many subspecialties. It has the digestive pediatric surgery, including liver surgery. You have pediatric urology, pediatric thoracic surgery, and pediatric vascular surgery. In Lebanon, it is very hard to dispatch them. Okay, so it's very hard to just choose one subspecialty to train in this subspecialty and to practice it, because you will not have enough load and you will not have a successful career if you do that. Okay, however, in Europe and in the US, you will never find digestive pediatric surgery doing pediatric urology. What doesn't pediatric surgery include? It doesn't include cardiac surgery, neither neurosurgery. It does not include, in Lebanon, pediatric orthopedics. However, in France, for example, pediatric orthopedics is part of pediatric surgery. Okay, so you will have to practice orthopedics if you want to have your diploma in pediatric surgery. In Switzerland also. Pediatric plastic surgery, it has always been part of pediatric surgery. So in our textbooks of pediatric surgery, pediatric plastic surgery is in those textbooks. So you'll have chapters of pediatric plastic surgery. However, now actually in Lebanon, we don't do any more pediatric plastic surgery. So we have plastic surgeons that are specialized in pediatric plastic surgery. In France also, in the US also. However, in Switzerland, pediatric plastic surgery is still part of pediatric surgery. Are there any requirements? I would say no. I think, and I believe that everyone can become a pediatric surgeon. Everything can be taught and everything can be learned. There are many people who have a niche, who have a natural skill in managing and in manipulating surgical instruments and placing their sutures, and even in dealing with parents and dealing with people and with children. However, that doesn't mean that those things cannot be taught. I think everything can be taught and everything can be learned. Having those natural skills is certainly a plus. However, it is not a condition to become a skilled pediatric surgeon. However, there are many things you will not find in the books. For example, respect, kindness, and politeness. If I have one advice to give you, is to always be kind, and I always repeat this in maybe every presentation I make. Always be kind and always be polite with the people you work with the staff, with the nurse, even with the cleaning staff. You should be respectful. You don't need to be aggressive, even if you're a woman. You don't need to be aggressive. You don't need to be impolite and rude to make a point. Okay, so always be kind and always be polite. You will not learn this in the books. You will have bad days. Sometimes you will lose your temper. Sometimes you will go out of your mind. You are a human being. Always apologize. This is very important. And you will see that during your practice, this is more important than your skills. I believe that women have something special. I believe that whenever there's a woman in a place, and in the operating room, for instance, there's a forced respect, there's magic, there's something that happens. I believe that women have a plus. I love men, we all love men, we need men, they need us, but women have a plus, and I think that we should not lose this. Women have, I don't think women should always defend their place and should always defend their position. I don't think we should always claim to be equal to men. We are beyond this. It's nice to encourage women to become surgeons and to become doctors. It's very important. However, I think we are beyond equal. Okay, the word equal is very weak. I think that we have something more. We have many qualities and we should take profit from this. We have different soul, we have kindness, we have grace, and you will see during your practice that many will come to you because you are a woman rather than because you are a skilled surgeon. This is very important, and you will remember what I said when you become accomplished women surgeons. So if I have one thing to tell you is that if I have to end this, I would say that if an operation is difficult, it's because you are not doing it properly, whether you are a man or you're a female surgeon. If you apply this rule during your practice later in your life, you will tend to be perfect. No one is perfect and no one will ever be perfect. You will tend to be perfect. And when you apply this, it will help you to set your limits, because it's very important to decide when you should not operate. It's very easy to decide to operate, but it's very hard to decide not to operate, and especially in children. So when you apply this rule, it will help you set your limits. It will help you say, stop, I will not operate this child, and it will give you the courage to say, I need help and I am unable to operate this child by myself. Okay, so I hope I helped you with everything I said. I hope things are clearer in your mind concerning pediatric surgery. And thank you for listening to me.
Thank you so much, Dr. Lara, for this enlightening talk. If anyone has any inquiries, please feel free to leave them in the chat box.
One second, because I can't see. Chat. Yes, I think that pediatric surgery is promising in Lebanon and elsewhere. It's a wonderful specialty. I do manage my social life as a surgeon. I have a boyfriend and I'm very happy. Thank you. I know it was a little bit short. But if you have questions, you can also join me on my WhatsApp. So you can have my number from Zainab. I think she has my number. And you can send me emails also. So you are free to do that. If you want to increase your chances to get matched into pediatric surgery, you should read. Read. Everything is in your books, except ethics and what I said about respect and politeness.
Okay, so I think that's all for today. Thank you so much again, Doctor, for joining.
Thank you.
And thank you, everyone,
for having me.
It's our pleasure. Thank you, everyone, for attending. See you next week.
Bye.